Hello. Welcome to AnimatedTeeth.com and our page that discusses surgical tooth extractions. It seems likely that anyone would have some confusion about what the term surgical extraction actually means. After all, pulling any tooth is considered oral surgery. Well, dentists and the coding system that's used for filing dental insurance claims generally categorize extractions into two broad groups. One is simple extractions. This term applies to most procedures and refers to the situation where the tooth being pulled holds a relatively normal position in your jaw and the steps needed to remove it are straightforward and routine, like the case where a dentist can grasp the tooth with extraction forceps and then wrestle it on free. The term surgical extraction applies when some type of additional steps are required. Exactly what's needed will be different with each case, but some common examples are raising a gum tissue flap, removing bone from around the tooth, or dividing the tooth into sections so each piece can be removed separately. As a starting point in explaining further, you might wonder what kind of situations might warrant a surgical extraction. Well, removing impacted teeth or a residual root tip, like one left behind during a previous extraction attempt, are common examples. In both of these cases, the tooth or root remnant can't be directly handled and removed because it lies underneath the gum line. Extra steps will be needed to create access. Other examples can include severely broken teeth, like those broken off at the gum line and therefore are difficult for the dentist to get leverage on with their instruments. Or teeth that seem fragile and are expected to break, possibly problematically, when using a conventional extraction approach. As a last group, some teeth that require a surgical procedure are generally intact and do have a relatively normal positioning in the jawbone. But as a complication, they are anticipated to be difficult to remove. This might be because they have exceptionally long, curved, or divergent roots, or their surrounding bone tissue is exceptionally dense. As far as what additional procedural steps might be needed during a surgical extraction, here's an example that illustrates the need for three common ones: raising a gum tissue flap, removing bone tissue, and sectioning the tooth. Our animation here illustrates a lower impacted wisdom tooth. It still lies fully underneath the gum line and, in fact, is entirely encased within the jawbone. As yet another challenging feature, the tooth has an abnormal orientation in that it lies on its side. As a process, it's pretty obvious what the dentist will need to do to get at the tooth. They'll first flap open the gum tissue to expose the bone underneath. They'll then remove the least amount of bone possible that still gives them adequate access to the tooth below. As a final step, and one you probably don't have any familiarity with, to get the tooth out more easily, and through a more conservative opening in the bone, the dentist will section the tooth, meaning they will cut it into pre-planned pieces so each one can be removed separately. With that case, it's pretty obvious why all of those steps are needed. But why would a surgical extraction be needed for a tooth that's already come through the gums? Well, take a look at this next animation. The tooth is fully erupted. Its roots aren't exceptionally long or curved. But maybe the dentist has already tried to muscle this tooth out and they just can't get it to budge. As an explanation, maybe the bone tissue surrounding it is exceptionally dense. At this point, the dentist's concern would be that if they use an even greater level of force the tooth may break and that could complicate the procedure. A solution could be to section the tooth in half so they can address their efforts to just one root at a time. Divide and conquer. With this case, the act of sectioning the tooth changes the previously attempted simple extraction into a surgical one. Changing course in midstream isn't uncommon if difficulties are encountered. But different than with our impacted tooth example, no gum tissue flap or bone removal is needed to create access. The dentist will just drill directly into the tooth to cut it in half. As another example of a surgical extraction, here's an animation that shows a severely broken tooth. With this case, there simply isn't enough exposed sound tooth structure for the dentist's instruments to get leverage on to remove it. As a solution, if a gum tissue flap is raised, the dentist can then trim away some of the surrounding bone, so to lessen its grip and expose more of the tooth so the dentist has more to work with. Maybe the dentist will even section the tooth into two, like with our last example. So, the steps taken here, while the same as with our impacted tooth example, are implemented differently. But it's still a surgical extraction. So, now you know some of the steps that might be taken during your procedure and why. But there's one last point we'd like to cover. Some people might cringe at the idea that their tooth requires surgical extraction. And we get that concern. After all, having one probably sounds like a whole different ballgame than what you likely expected. But what you'd be overlooking, especially in cases where the need for a surgical process isn't so clear to a layperson, is this. It's not just that your dentist has concluded that the additional steps will help them get your tooth out more easily. They're also trying to ensure that your extraction process creates as little surgical trauma as possible. This is important because your healing process and its risk for complications will be influenced by what has occurred during your surgery. Yes, incising gum tissue, removing bone, and sectioning a tooth will create trauma. But that which occurs during a poorly planned, difficult simple extraction can be expected to be greater. This can include traumatizing surrounding bone tissue due to an inordinate amount of prying at or rocking back and forth on a tooth that is reluctant to yield, or bruising or even tearing soft tissues in an ad hoc attempt to gain better access or visibility. Not to mention that the degree of difficulty of the extraction can be significantly raised if some type of unfavorable tooth or bone breakage occurs. The fact is, the dice were already cast long before your dentist informed you that you needed a surgical extraction. Evidently, your tooth has challenging characteristics. And planning to remove it surgically is your dentist's opportunity to improve your procedural experience and minimize your potential for post-operative complications. So, try to see things in that light. With that, we'll conclude this video. Our page contains many more details about surgical extractions, so be sure to give it a read. Good luck with your procedure. Goodbye.